Hello everyone, welcome to our OET speaking channel, SOANZ HUB.
Today we will be dealing with bunion surgery.
Let's go through the task.
Setting, hospital ward. You are speaking to the son or daughter of an 82-year-old female patient who had bunion surgery 2 weeks ago. The patient will be in the son's or daughter's care for the 6 months recovery period.
Task 1. Find out how prepared the son or daughter feels about their mother's discharge to their home. 2. Explain the mother's needs for the first 8 weeks, NSAIDs or painkillers, dressing changes, mobility, personal hygiene, meal preparation. 3. Reassure the son or daughter that it is manageable and give advice on strategies which will make caring for their mother easier. Set up a routine, get a medicine organizer, ensure she has everything she needs nearby, wear a surgical boot. 4. Explain the role of the surgical boot. Protects the foot. 5. Explain the painkillers and anti-inflammatory drugs. 1 times naproxen, painkiller and anti-inflammatory every 12 hours. Ibuprofen, painkiller and anti-inflammatory times 2 every 4 hours. Not to exceed 8/day.
Let's start the role play.
Good morning, Mrs. Debbie.
Good morning, nurse.
How is your mother?
She is doing good.
So happy to hear about that. As you are aware, your mother is going to be discharged today. Isn't it?
Yes, nurse.
Before proceeding further, may I ask some of your details? Please?
Yes, sure.
Are you aware about the time period required for your mother's recovery?
Yes, the doctor said that the time period is for 6 months.
That's right. And who will be taking care of her during this time?
I will.
You did the right decision. I appreciate you.
Thank you, nurse.
Are you prepared for taking care of your mother?
Actually, nurse, I am not sure regarding the care I have to provide for my mother.
Well, Mrs. Debbie, I do perfectly understand your concerns. Don't worry about that. I will give a clear picture regarding the amount and type of care you have to give to your mother.
Okay, nurse.
Thank you for sharing your details, Mrs. Debbie. Now I will explain about the care. For the first 8 weeks, you have to take care of your mother continuously. At that time, you need to assist in her mobility. Her dressings has to be changed and administer painkillers, as well as other medications prescribed by the doctor. Are you getting my point?
Yes, nurse.
All right. Also, it is essential to prepare nutritious meals for your mother for attaining good health, and it is important to maintain personal hygiene. Are you following me?
Yes, but I am really surprised regarding the care I have to provide for my mother. And I am concerned because if I made a mistake, how can I manage that? I'm really worried.
Mrs. Debbie, there is nothing to be overly concerned about. It can be managed easily. For taking care of your mother, I will give some advices and strategies. If you follow all those, definitely your mother will recover soon. How that sounds?
That sounds great.
So, Mrs. Debbie, for making things easier, you can set up a routine. You can keep a medicine organizer beside your mother's bed. Also, ensure that everything is available nearby to her. And you need to make sure that she is wearing a surgical boot.
All right. Nurse, is it really necessary to wear a surgical boot?
Yes, it is. While wearing a surgical boot, the foot will be protected. So, it is important to wear it. Try to encourage your mother and educate the importance of wearing surgical boot. Are you able to do so?
Definitely, nurse.
Good, Mrs. Debbie. So, is there anything else I can do for you?
Nurse, I would like to know regarding the medications. I am not sure about when and how to take all those. So it will be beneficial if you explain that.
That's a reasonable question. And I'm glad to explain those. Regarding the medications that doctor has prescribed, painkillers and anti-inflammatory drugs. In that, one naproxen tablet has to be taken every 12 hours. And 2 ibuprofen tablets needs to be taken at every 4 hours. Please note that this ibuprofen tablet not exceed more than 8 in a day. Are you following what I am saying?
Yes, nurse.
So, Mrs. Debbie, do you need any more clarification?
No, nurse. You cleared everything.
Fine. If you have any further concerns, please contact us. We will definitely help you.
Okay.
Thank you, Mrs. Debbie, for your cooperation. I wish your mother a speedy recovery. Take care of her. Bye.
Bye.
That's the end of your speaking session.
For more videos, please subscribe our OET speaking channel, SOANZ HUB, and press the bell icon.
Also, comment your suggestions and share with your friends.
God bless you.